We usually give the patients some pre-op and post-op information after their first visit to the clinic, after consultation. We document what was decided on the day of the clinic, what type of transplant we were going to perform, costs involved. We give some advice then just regarding pre-op and post-op care, or pre-op and post-op expectations. So initially, before the surgery, we would advise patients, for instance, in that week beforehand not to take alcoholic drinks, just to avoid bleeding during the procedure. We sometimes ask them to shave the recipient area also just a week or two before the surgery. After the surgery, we try to give them information, basically understand or predict the process that's involved after the surgery, particularly those first couple of weeks. So most patients would expect that within that first week they might expect some eye swelling, they might expect some pain in the back of the head. There might actually be some scabs which have to be left alone within that first week. Patients will usually return to the clinic maybe 10 to 14 days after the procedure to have the scabs removed and to have some PRP injections. We would warn the patients that in the next couple of weeks, first of all, the hairs that have been implanted in the original grafts would often fall out, that they might also experience some shock loss affecting the pre-existing hair that was already there in the recipient area, which would recover or regrow within a number of weeks. We would let the patients know that their new grafts might not actually grow to about 3 or 4 months, and that they would actually take up to 6 months to actually grow to any length. Patients would be warned of the need to take post-op medications such as finasteride to stop ongoing hair loss, and they would be invited back to clinic again at 6 and 12 months. But all of this information would be given to the patient in the written communication that we engage in with the patient just after the first clinic visit. We also send them consent forms for surgery, which are very informative, consent forms for finasteride, again, which are hugely informative for most patients who don't know an awful lot really about the process if it's their first time actually going to a clinic to inquire about this.